Welcome back. Our next presenter for today is Samuele Contestabile. Samuel will share his research on healthcare at home. Thomas's mentor is Selena Stegeman. Thomas, I will turn it over to you.
Hello, everyone. Thank you very much for being here today. My name is Sam. I come from Italy. I'm a student here. I'm a senior here at Queen's University, majoring in finance, marketing, and management. And today I'm going to try to explain this marketing research that I've done in collaboration with my mentor, Selena Stegeman. And the project involves hospital at home. So just to give a very brief explanation of what hospital at home is. So actually, hospital at home is something that we started to learn about after the COVID pandemic. If you guys will let me use the word positive, it's probably the only positive thing that the world actually learned with the COVID pandemic, because we know that caused many, many issues around the world. But at the same time, we actually started to understand and learn that many, many things, especially in business, can be done remotely or online or virtually. This is something positive because through the COVID pandemic that happened 2 to 3 years ago, hospitals all around the world, especially here in the United States, started to realize that many cures, many medications, and people can actually help. Instead of actually going to the hospital, they can deliver the medications directly at the home. Obviously, this is a very brave and courageous project that many hospitals are trying to actuate as of right now. But this is more of a future project because it can actually help many, many people in the future. The main purpose of this hospital at home, the main goal will be obviously to try to deliver as much cure, as much medications as possible in the future. And the very good thing would be that it offers the opportunity for people to not having to go to the hospital, but they can get medications directly at their house through the use of nurses that can come twice every day. And there's a constant monitoring through online platforms that will help basically the patients to get monitored virtually through nurses that will be at the hospital, so that will know in real time, live, if something happens to the patients, and they can directly go to the hospital, to the home. What is the main purpose? The main purpose is actually to offer a better service to the people, because we all know that, and I'm sure that everybody's aware here, that during the COVID pandemic, we've all been through friends or parents that have struggled with the pandemic. And there was actually many problems that we still here have many problems to maybe get to the hospital. Maybe it's too late, or maybe it's just a very struggle. Imagine people that cannot walk or just have difficulties or have to call parents or families to drive them to the hospital. It's just a very, very struggle. So this would basically help to the hospital to offer a better service to the patients. And at the same time, we actually learned to the COVID pandemic that now many people are actually scared, obviously, because we all know that now there are many diseases out there that people are just scared of and don't necessarily want to be around people, do not want to be close to other people, to other patients. So the hospital at home will offer them the chance to not having to go to the hospital and be around that kind of environment, but instead staying at home. This is a kind of present conditions, because as of right now, hospital at home is actually delivered, and many hospitals offer them. But as of right now, these ones are the only conditions that are eligible as of right now for people to be able to receive a hospital at home or care at home. Those conditions are cellulitis, COPD, CHF, pneumonia, UTIS, dehydration, deep vein thrombosis, pulmonary embolism, acute viral illnesses. Obviously, I would like to mention that I'm not even close to be Medicare or like a medication major or anything like that. So I'm just here to deliver a marketing business presentation. So I'm just here to explain what are the conditions that are eligible for it. But this is obviously a presentation centered on the marketing point of view. And today, the main payers for those conditions are Medicare, Medicare Advantage, and Medicaid. I mean, I'm sure that I will not have to explain that, but also everybody knows probably here is that in the United States, healthcare is not obviously free. We know that a lot of countries in the world offer free medications and free healthcare, but in the United States, you have to go through insurance purposes in order to get medications. So those are one of the aid that the government gives to patients in order to help pay. Medicare, it kind of works like a premium. So you're eligible after 65. You pay a premium, and you have basically free some conditions are free to get help with. It's divided into 3 parts. It's divided into Part A, B, and C, and most of people are eligible for at least Part A and B. So the importance of hospital at home. I'm probably going to stress this concept very much during these presentations, because I believe this is something that this is how the future is going to look like in the next 5 to 10 years, and it's just going to improve. As we all know, especially in the business world, like I already mentioned, everything is going to switch online. I'm sure that everybody here in the audience knows and has been part of that switch, as we have many clients that we just meet online, or we know that physical businesses are trying to switch everything online, also because obviously the first thing that they teach you in business is that how do you lower the cost and you maximize your profits. And this is basically what's happening, because we know that the healthcare market is a huge business here in the United States, and obviously they would like to try to switch as much as possible online so that they lower the costs, but at the same time deliver also a better quality services also well. And this is something that we learned very well during the pandemic. And this is just where the future is going. And I'm sure that I don't have to explain how everything is going to switch online in the next 10 years. Probably many more things are just going to be online. We already seen with the education, for example, with schools offering almost everything virtually. And like many other things, especially in business, it's a very fast-growing market that's just destined to increase and be even greater in the future. And this is just a little bit of data. Obviously, this is nothing crazy to understand. It's nothing very hard to understand. You can clearly see how this is just a market that is destined to grow, and it's been growing, and it will grow until 2030 very, very highly. Just in 2020, we knew that just the home healthcare market, which is a very minor market in terms of healthcare, was just worth $4.1 trillion, which is a huge amount of money. But at the same time, research have found that just that market by 2028 will be worth $6.5 trillion. And this makes us understand, and obviously everyone understand, that this is just where every country, especially the United States, is trying to invest. Because if we are investing all that money, means that the country cares about switching at least some of their patients online or virtually and hospital at home. So I would like to make a comparison between the present and the future. As of right now, like I already mentioned, this is something that is already delivered right now, but in the future it would just be growing very much. As of today, as of 2025, it's been shown that just the healthcare market, so the entire one, would be worth $250 billion, and it's just fast growing. And I actually had the pleasure to speak a little bit with the QMG, and because the mentor is marketing and business development there, and they said how they would like, at least in the next 3 to 5 years, try to switch 10 to 20% of their patients to a hospital at home. And since this is a market research presentation, the first step in order to understand the market is to develop a marketing strategy. For this specific for the purpose of this presentation, I developed a marketing strategy divided in 5 points. The first one will be physician referral strategy, process simplicity, online and social media advertisements, creation of community events, and also community networking versus standalone networking. So the physician referral strategy, this is as simple as it sounds. It just means that physicians and doctors will have to do a better job, or just implement or just increase their relationship with patients. We all know that here that whenever we're going to the doctor, it's not just to get help. We just don't receive medications. We actually have a meaningful relationship with them, because obviously they know actually much more than you probably know yourself about you. So that you kind of connect. You have that connection with your doctors. So those doctors have to try to create even a better connection with the patients in order to educate them and let them understand what are the positive and benefits of hospital at home, and what patients can do and what they cannot do at home, or what they can do at the hospital, what they should do at the hospitals. The other thing is that the process has to be easy and simple. I think this is a very important point, because especially talking to a business standpoint, we've seen many innovations over the years which they were way too much complicated, and just the target audience wasn't ready for that. And we saw how many innovations couldn't actually be actualized or just brought to life just because they were too complicated in the audience, and the process was just too hard for them to understand. And since this is a project that, at least at the beginning, will be aimed at people over 65, so therefore elderly people, elderly patients, the process has to be as simple as possible so that they can understand and they can actually try to benefit fully from it. So the process will have to be as simple as possible. The platform will have to be very user-friendly, not too much complicated. And at the same time, the monitoring has to be 24/7, obviously, since we all know that something can happen at any time, so the patients have to be monitored at all times. And I'm sure that I do not have to stress too much about this topic, the online and social media advertisement, because we're all aware of it and we are part of it, actually, every single day. We just face social media and online advertisement every day. It doesn't matter what we do. Obviously, I think that since everyone and every hospital in the country, outside the country, internationally, try to advertise and put advertisement online, at the same time, I would push on trying to create actual content where people can see and where people can get actually educated about the topic. Maybe show what actually means hospital at home, what are the cures, what are the medications that can be delivered, and what are the ones that cannot be delivered, the conditions that are eligible for hospital at home. And maybe in the future, they will actually show how are the benefits, maybe a comparison between the present and the future as well. And the medias that I would suggest to use in order to push this online and social media advertisement would be obviously YouTube, streaming platforms like Twitch, and others. And I think this is also another important point, which are community events. I stress this topic especially for towns and cities like Quincy, because it's a very small town, but at the same time the community is very strong. Everybody pretty much knows each other, and it just helps a lot in terms of creating new innovations, creating new things. Where we have the chance to be part of these communities, I think it's a very good pleasure, and it just helps in terms of if something new happens or if there is an innovation coming up. And I think hospitals and especially doctors should try to push and create community events in order to educate and prepare the audience to understand what is hospital at home and what are its benefits. And it would just be beneficial for everyone, especially also for nonprofit organizations, because, again, stressing this point under a business and marketing point of view, we know how many things that need to be developed at the beginning, you need a lot of funds, a lot of money in order to start those projects. So I think that starting with a nonprofit organization that can sponsor that would be a great choice. And networking. Networking is something that everybody, especially here in the United States, is aware of. I feel like the United States is where the networking was actually born, since everybody does networking. It doesn't matter what field are you in. Networking is very important. I do not necessarily mean networking for patients, but I mean it for especially doctors and physicians around the world. And I say this because obviously this is a complete innovation and a very bold project that will be actuated probably in 10 to 15 years. It will be much, much better than now. So this is something that is not perfect at the moment. It cannot be perfect since it's something that has been just developed. So I believe that physicians and doctors all around the world doing networking will be just beneficial, not only for the patients, but also for the services that they're offering, since they will try to help each other and to create a better service and a better communication with the patients as well. And now we reach the target market. Obviously, when you develop a marketing strategy, the target market is one of the most important things, since you have to know who are you delivering the product to or the services to. And I found that this service will be targeted mainly to patients over 65 years old, people with disabilities, people with chronic conditions, people with acute conditions, and pandemic-related diseases. I would like to say again that this is just the present condition, so this is as of right now. However, I believe that if this project will continue in the future, as research have shown, this will be delivered to everyone, to every single patient all around the world for any kind of conditions. But as of right now, the target market is limited to these patients. And the next, what I did for the target market is to develop 5 profiles of people that we might know, that might be present in the audience, and that are actually present in the world, and they are eligible for hospital at home. And I just made this profile so that people here in the audience and in general can understand, they can maybe face similar people and understand how this can be beneficial. So, for example, the first profile will be Julie. She's 70 years old. She's married with her husband, who is much older than her. It's hard for her to reach the hospital. She has the acute condition that she has is cellulitis. She doesn't have any severe disability, but she has difficulties to walk. So this is a very clear and a very clear example of a very elderly person who has problem to reach the hospital. So for her, it will actually be much cheaper and more less expensive to get medicated, because it doesn't matter. I don't know what you guys consider as things that save your money, but in my equation, I will also put that if I can save time, that's actually a lot of money that I saved. So for her, just the fact of having to maybe call her child or someone to try to pick up the car and having to go to the hospital, that's just a huge saving. So, and her strong motivation would be that she will be eligible to take care of herself without having to go directly to the hospital. She will have nurses coming in at least twice a day to get medicated and to help her. And obviously, she also wants to make healthcare more affordable. The marketing strategy I also developed, when I created these profiles, I also developed a marketing strategy aimed for each one of these profiles. So for Julie, I think the best 5 marketing strategies would be the word of mouth, the use of newspapers, TV stations, radios, and community events. I say, obviously, she's an elderly person, so she probably wouldn't be attracted, or she wouldn't be on social media or online advertisement. I'm not saying that she will not be 100%. I just think that these are the marketing strategies that will best work for her profile, especially the word of mouth, especially in that communication that I was talking about before, about between the patient and the doctor, and also through the creation of community events, maybe where her child is a part of and can actually deliver the message and get educated in order to help her or just her parents. The other profile that I developed is Sarah. She's 55 years old. She cannot walk. She's in a wheelchair. She's not independent, so therefore she needs constant care. She has a CHF. Her husband works more than 60 hours a week, and she needs to hire a professional in order to take care of her. So this is just a clear profile, actually a perfect profile for hospital at home, since it would be very, very hard for her to reach the hospital. And it would be much more expensive, since she has to hire anyway people that will take care of her. So hospital at home would actually be a perfect match, since she, instead of hiring the people to take care of her, she will have the nurses coming in at least twice a day. And the marketing strategy for Sarah would be commercials, TV shows, social media, work-related events, and email marketing. I feel like that commercials and especially TV station for this target market would be most beneficial, and also social media as well. For the next profile, we have Matthew. He's 55 years old. He has health risks, so the condition that he has will be diabetes and obesity. He rarely goes to the hospital. He works more than 50 hours a week, and he is also married. Obviously, these are not, I just try to create and associate pictures with, this is not real life people. I wanted to make sure of that. And his motivation in order to choose hospital at home would be to get back to work as quickly as possible and also to make it more affordable as well. The marketing strategy for Matthew would be very similar to the one before, to the patient before. So it would be commercials, TV shows, social media, work-related events, email marketing, community-sponsored events, and also networking. Obviously, if you work, it would be easier for you to try to network and get even more educated. It doesn't really matter what kind of field you work in, but at least getting educated on what hospital at home can be or what are its benefits, I think, would be very much beneficial. The next patient will be Bob. He's 75 years old. He lives with his wife. He has minor health issues. He suffers from dehydration, and he would prefer to get assisted at home with his family. I think this is a perfect profile to make us understand another point and something else that would be, it's a kind of a side thing of hospital at home, but it's actually very important. Through the COVID pandemic, we were aware of probably our family members or just friends where they were at the hospital, but we couldn't visit them. And I believe that especially in those kind of conditions, mental health just decreased very much. And this is just a fact. It doesn't have to be. It's been proven how mental health issues can actually even decrease your ability to recover physically. And for these people, for elderly people that would just be left alone in the hospital, it doesn't matter if you have the best cure. I think that if you were to have your family around you to help you and support you, it would just be much more beneficial. And I know it can sound like a sidetrack of the hospital at home and its purpose, but it actually is one of the main purposes of it. And his motivation will obviously be trying to be with his family as well while he's getting treated, but also he'll be easier assisted and will have his family with you at all times and doesn't have to go necessarily to the hospital in order to get assisted since he's very, very older. And the marketing strategy for Bob would be commercial, TV shows, can be social media, work-related events, email marketing, community-sponsored events, and networking as well. And then the last one is Elizabeth. Elizabeth is 55 years old. She has family and a very sick mother. She's scared of contracting COVID and other types of illnesses. She works between 40 to 50 hours a week, and she has 2 kids that she has to take care of. I think this is a profile that matches a lot of maybe us in the audience of people around their age that have to take care of kids and just their parents and just don't have sometimes the time to just switch between them. So hospital at home offers a perfect match that can help the child or the person, helping them to try to meet those needs. And obviously through the COVID pandemic, we saw how there are many people that are actually now scared of going to the hospital just because you can contract any kind of disease and also because you're exposed to that kind of environment. So information in order to get hospital at home would be scared of being exposed, and it would be much easier for her to assist her mother and the child. And the marketing strategies would be commercials, TV shows, use of social media, work-related events, email marketing, community events, networking, and also newspapers. And that was it. I thank you very much for listening to me today.
Any questions?
Have you thought about, as for marketing, using religious communities in some way?
Yes, I think the use of any kind of community, especially religious communities, could be extremely beneficial because obviously they can educate the audience, because it doesn't matter necessarily what kind of community you're a part of, as long as you can understand what is the message behind that community, I think it will be extremely beneficial. So yes, thank you very much for your question.
Thank you, Samuel. We're going to take a quick break, and then we'll have our last presentation starting at 11.